So our healthcare profession needs people with resilience, compassion, dedication, but the demanding nature of our job can often lead to burnout. What's up, it's your favorite NPHP, and welcome back to my channel. As promised, we are going to be talking about burnout. I know it's been some time, but life's been lifing. I've been focused on my fitness journey, but we are here now. Hi, my name is Harriet. I am a nocturnal nurse practitioner. I've been practicing with hospital medicine for the last 8 years. Please watch this video in its entirety because at the end, I love to share and discuss Bible verse. So let's jump right into this. What exactly is burnout? According to the APA Dictionary of Psychology, burnout is not a medical condition. Rather, it's a physical, emotional, or mental exhaustion that relates to your job, your work, your career. And as healthcare workers, this occurs when we are constantly exposed to high level of stress. A few symptoms of burnout: low motivation to go to work, feeling physically exhausted, feeling emotionally drained, lack of energy that affects your productivity, difficulty concentrating and making decisions. You'll start to see changes in your sleep patterns. Depending on the severity and duration of burnout, you might experience physical symptoms such as headaches, nausea, and even change of appetite. And this is the goal of getting this information out there to you guys, so you guys know what to look out for if you are experiencing burnout, because we do not want it to get this severe to the point that you're experiencing physical symptoms. Next, let's talk about dangers of burnout. So burnout can have negative consequences both for healthcare workers and our patients. So some dangers that we can experience as nurses and nurse practitioners are increased risk of errors, decreased job satisfaction, increased absentee. You might find yourself calling off more, increased turnover rates, and health problems such as like depression, anxiety, and even heart disease due to us being in this state of always experiencing these high level of stress and not knowing how to manage it. So the dangers of burnout in relation to our patients: they may experience decrease in quality care, increased risk of complications, increased length of stay, and decreased patient satisfaction. So now the big question is, how can we prevent burnout? So first thing is keeping a good work-life balance, which is something I live by. When I'm home, I do not check my work emails. If it's something important, my boss knows how to, or anyone knows how to, get in contact with me via phone, text, if it's that important. At the same time, my coworkers, they know not to call me about drama that's happening at the hospital. I try to schedule myself working 3 in a row and then having a lump sum of like 6, maybe to 8 in a row, depending how it falls. I also try to at least use a mental health day, like 1 PTO day a month, because it's needed. Like, our job is stressful. It's not going to change. We're caring for patients. Next will be identifying and avoiding toxic work environment. Unfortunately, there's some organizations that they're not here for us. We nurses, nurse practitioners are not their priority. Or in extreme cases, we can experience emotional abuse. If you know you're in a toxic environment, it's just time to look for a new job. Don't stay. It's not going to change. You can't change the organization. You can't change the mindsets of these people. It's time to look for a new environment. Next will be knowing your role expectations. Not knowing your role, you're just setting yourself up basically for failure. People could, again, take advantage of you. Just not knowing your work expectation just could lead to undue stress and you doing a lot more than you even have to. Next will be identifying and utilizing your support system inside the hospital and outside the hospital. I have my mother that I could talk to and vent to. She works in healthcare, and then my work friends, I could always vent to them and they could vent to me, and vice versa. But yeah, just knowing somebody and having somebody you could trust, and they could just be honest with you. But just knowing and having somebody that you could trust and discuss things with, just to vent, to get things off your shoulders and not to boggle things up, because when you keep things in, all it does is build and build and build until you explode, and this is what we're trying to prevent. Next will be exercising, getting outside. As you know, my hobby is working out. I'm also a personal trainer, but working out is my medicine. Working out is my Ativan. Working out is my stress reliever. Working out is my go-to. Working out is my me time. Just exercising, all in all, for everyone is a must, just to, stay healthy. Get outside, enjoy the vitamin D, the sunlight, the fresh air, the birds chirping. If you're an early person, make your coffee and just go outside to your driveway. Go out and sit on your porch if you can, or go outside during the evening, have an evening stroll. It's just amazing. It's a wonderful stress reliever. But next will be sleep. Getting 8 hours of sleep, we hear is the best thing we could do for ourselves. And no, working nights, it's hard for me to get a full 8 hours sleep, but getting a good 8 hour just allows our brain to recover from our previous hard shift, and because we don't want to go in, we don't want to leave work stress and still bring that same stress from the shift before to the next shift, just going to be building up on each other and then leading to burnout. Next will be practicing mindfulness. So it's like deep breathing, being present. And I think this is one of the best things we could do is practice mindfulness, because you could do it anywhere. I do it when I'm at work. If I'm very busy and it's like, I feel like I'm losing control, I pause, take a break, I woosah, deep breath, and it's like, Harriet, you are okay. It's like I talk positive words of affirmations to myself, like, Harriet, you are okay, you got this, you know what you're doing. You could quickly reset your mind when you practice mindfulness. You could do it anywhere, anytime. And next will be avoiding excess alcohol, eating a healthy diet, just overall feeling well. And avoiding excess alcohol, the point of that is, basically, if you're already drinking a lot, you're at risk for continue to drink more. And we all know where that could lead you. And we don't want to go that route, right? Next will be prioritizing self-care. Again, another big thing that I live by. Self-care for, everyone will be different. My self-care, I have to work out physically. Me working out, drinking my gallon of water, eating healthy, balanced meals. Our career is all about helping others. In order for us to continue to help others, we know we have to make sure we are good mentally, physically, spiritually. Prioritizing self-care is a must. Next is getting professional help. If you are just so stressed and you just can't manage, you're trying these things and you can't manage to decrease your stress level at work, professionals can help you. Therapists, therapy can help you navigate through this. And last but not least is ultimately looking for another job. If you tried all these things, self-care, managing a good work-life balance, exercising, eating healthy, avoiding, excess alcohol, you're practicing mindfulness and still you're experiencing high stress level, maybe that job is just not meant for you and you need to look for a better job that suits you, This is our career as nurses, nurse practitioners, PAs, doctors. This is our career. And hopefully you guys, chose this career for good reasons. And at the end of the day, you want to be happy and you want to be happy, comfortable, and just passionate at what you're doing, with your career. I can't imagine just being miserable, being down and being unhappy, going to work each day and then having to care for patients in this mindset. So definitely got to choose, first of all, the career that aligns with you. At the same time, if it's nursing home, if it's in the hospital, outpatient, specialty cares, you just got to find what works for you. Have I ever experienced burnout? And yes, I have. It was actually last fall when I was going through a lot personally, which is probably why you guys haven't seen a lot of videos during the fall months. But I was actually trying to diagnose myself. Like, is this like seasonal depression? The weather was changing. It was getting colder out. It was now getting darker when when I go into work, since I go into work at night. I'm like, what is this? What am I feeling? I was just feeling down. I wasn't happy. Like I was like angry. And you could even ask one of my close friends, because I was like talking to her about it. Like, I don't know what I'm feeling. I actually came to a point that I was trying to find a job. What could it be? And, I just started to pray. I started to pray, asking God, like, what is it? I don't know what I'm feeling, but this is not me. I know H. I'm a happy, cheery girl. Like, I love just spreading positivity, always having a smile on my face, waving, saying hi to every person that I pass by in the hospital. And I wasn't doing that. So it was like, this could be burnout. This could be burnout. So I need to change something. And at that time, my schedule wasn't the best. I was working 2, off 3, working 3, off 2. Like, me personally, I cannot manage that. I could do it for maybe 2 weeks, but months on end, oh no. Referring back to getting 8 hours of sleep and getting that recovery, allowing your brain to recover from the stress from the previous shift, it wasn't happening. Like, I was just building stress to the point then the anxiety set in. But yes, I did experience burnout. What did I do? I switched my schedule up. I made sure that I had longer breaks. I took more PTO around that time, and I just started to feel well. Again, I brought it to the Lord. I gave him my fears, my worries, my doubts in exchange for peace and feeling like H, smiling, driving to work, happy coming to work. So, and that's how I know, like, if I start to feel that way, it's like, what's going on? If you're feeling burned out or overwhelmed or just plain old like exhausted, just know that you're not alone. The beautiful truth is that we don't have to carry it all by ourselves. So today's Bible verse is Matthew 11:28-30. And Jesus is saying, "Come to me, all you who are weary and burdened, and I will give you rest." So no matter how heavy your load is, no matter how you're feeling today, you could bring it to him and receive real rest, receive peace, not just for your body, but for our souls. Take a deep breath, hand over your worries, hand over your fears, let his peace carry you forward. So thank you for watching this video, and just remember that you are deeply loved and never alone. Please, if you haven't already liked this video, like it. If you're not subscribed to your girl, subscribe. If you want to share this video to your fellow coworkers or whoever you feel that may be experiencing burnout, or whoever you feel that this information will be beneficial to. Until next time.